Hello, it's nice to meet you. My name is Helen Holmes. I'm a psychotherapist, psychologist, counsellor, and I also work as a family practitioner. My consulting room is based in northwest London, in South Hampstead. You can get in contact with me by my website, www.helenholmes, that's HOLMES, psychotherapist.com. You can also contact me by email, helen.holmes2023@outlook.com. My way of working is that I'm trained in multiple different therapy modalities, and I've been working as a psychotherapist for many years actually, with children, adolescents, adults, also couples and families. I'm trained and qualified to work with all of these different age groups. My main specialisms are linked to adolescence, eating disorders, which usually start in adolescence, also self-harm, as young people struggle with myriad turbulences in their bodies and minds, and with friendship groups externally too, can cause a lot of disruption in their lives as they start to turn away from their parents towards friendships which become of prior importance and, can be very hurtful, what happens in groups of friends. Another specialism that I've developed is in addictions. You could also think about eating disorders and self-harm as forms of addiction, but also drug and alcohol misuse, or you could say abuse. I can work well with this type of difficulty too, which is prevalent in many people's lives. A further area that I'm very proud to be able to work with, and a pleasure to work with, is people who experience psychosis. There is a group of the psychoses and also the schizophrenias. It's more common these days that people talk about the psychosis or the psychoses, a group of psychotic experiences that have been documented. But nonetheless, these are unusual experiences and usually cause the individual a great deal of distress. A lot of therapists are afraid of treating people with psychosis, perhaps because of the risk or perceived risk, or perhaps mainly because that they're not quite sure what they're working with. Having worked for many years and gladly on psychiatric wards for men and women, and sometimes mixed wards, I have observed at close hand and come to understand how to help individuals with psychosis, with a diagnosis or not of psychosis, of these such experiences. And my practice door is open to all these individuals, and actually my practice door is open to everyone. If you would like some help, then I can understand that it can be daunting to make that first step and contact a therapist, especially because you're not sure what they're going to be like or what it's going to be like to share your experiences. And I do understand what it's like. I've been through therapy myself to become a psychotherapist, you'll be pleased to know. And I do remember approaching people for counselling and psychotherapy many years ago. And psychotherapy, I think, is probably the cornerstone for empowering people in their lives. And to think about, medications, to work with this, perhaps to reduce the medications over time. And basically offering you a safe and confidential space where you can share, and I will have no other involvement in your life. So the psychotherapy, the space actually becomes very secure, and your mind adjusts to the idea that you're going to have psychotherapy at a certain time in the week. I hope that this helps. Again, please feel very welcome to contact me, www.helenholmespsychotherapist.com. My email again is helen.holmes2023@outlook.com. I look forward to the possibility of hearing from you, and in the meantime, do take care. Bye for now.